I'm going to officially go ahead and kick off our book launch today. Thank you all so much for joining us. This is the book launch for Seminal on Sperm, Health, and Politics, this beautiful book. Nice and thick. We've got a nice stack of them here from NYU Press. My name is Rene Almeling, and I am a professor of sociology at Yale, and one of three co-editors of this book, along with Lisa Campo-Engelstein, who should be spotlighted on your screen. Hopefully that tech is working. Lisa is the director and chair of bioethics and health humanities at the Harris L. Kipner Chair in the Humanities and Medicine professor at the University of Texas Medical Branch, and fellow co-editor Brian T. Nguyen, who is associate professor of obstetrics and gynecology at the Keck School of Medicine, the University of Southern California, where he's also program director for the Fellowship in Complex Family Planning. We could not be more thrilled to have so many contributors to the book here with us today. If you're one of the contributing authors, can you just give a wave or hold up your book if you happen to have it with you? Yes, hello, so nice to see so many of you. And thank you to everyone else who is joining us today, taking time out of your Wednesday afternoon or morning or wherever you might be. We are going to spend the next hour hopefully introducing you to this book and the range of topics and approaches that is covered inside of it. There is going to be a chance for audience members to ask questions at the end. We've disabled the chat because it can be quite distracting, so please go ahead and use the Zoom Q&A function. If you have questions as we go, or you think of questions in the Q&A portion, please drop them in there. And if it's possible, we'll ask you to sort of unmute and turn on your video and ask your question yourself. We also just want to give you a heads up, the session is being recorded. We hope to post this online so that we can share some of the insights from the book with a broader audience than just those of us in the room today. And then at the very end, NYU Press very kindly gave us a few extra copies of the book. So at the end of the hour, we'll post a link in the chat for you to enter a raffle to win a free copy of the book. So definitely plan to stick around for that. And for those of you who are not authors, and hopefully you've received your free copy in the mail already, we'll be putting in also a discount code, a 30% off discount code for anybody who'd like to buy it. And we would also love it if you recommended for your local library to purchase it. Okay, so that's the housekeeping. I'm going to start us off by describing this book, which I am so very, very proud of, and I'm so happy to be here celebrating it all with all of you. I want to talk about how it came to be. And to use a reproductive metaphor, this book was first conceived when Lisa and Brian and I started having a series of conversations about 3 years ago. We were all working in different parts of male reproductive health and from our different perspectives as a sociologist, a bioethicist, and an OB-GYN. And we were sort of all talking about the continued need to bring attention to male sexual and reproductive health and how could we do that. And so we decided to organize a workshop and it was held at Yale in April of 2023, so just a little more than 2 years ago. We put out a call for papers. We invited some of the major figures in different scholarly disciplines and different medical specialties in the world of law and policy. And we convened about 35 people in person at Yale. And I think part of why that workshop went so well was that we had asked everybody to write 1,000 words ahead of time. And the prompt was, what do you think are the most pressing issues at the intersection of sperm, health, and politics in the US today? And so the result was an extremely vigorous discussion over a day where we workshopped every single person's paper. And based on those conversations and the feedback, everybody revised their essays, which became the book that we have today. We were not aiming for consensus, and I don't know that we would have ever achieved consensus, even with more than one day of discussion. But what we were really trying to do was sort of spotlight the range of ways of thinking about sperm and its relationship to gender and race and health politics in the US. So the result is 30 short, very well-written essays that went through a lot of copy editing from the great team at NYU Press, and reviews by Lisa and Brian and I. They are written by experts across the social sciences, humanities, law, and medicine, and they do really offer this sort of kaleidoscopic view of the relationship between sperm, health, and the intersecting politics of gender, race, and reproduction. There's a pretty shocking number of different topics in this book. I think far more than any of us anticipated when we first started organizing this project. There is, we have an essay about the latest sort of technological developments for creating sperm in vitro gametogenesis, several essays on the specters of eugenics in contemporary medical markets and medical practices, emerging approaches to male contraceptive methods, male infertility, and trans healthcare, the controversies surrounding sperm donors and sperm banking, and disparities in sexual health for teens and young adults. So in our introduction to the volume, Lisa and Brian and I sort of point to how sperm is both fundamentally biological and fundamentally social. And we examine various aspects of the health politics of sperm, including how they're shaped by intersecting inequalities of gender, race, sexuality, and class. We describe and sort of foreshadow many of the essays which talk about the difficulty of incorporating male reproductive and sexual health into our current healthcare system and how it's organized. And we address what I think is a core issue for each of the editors and for what I think is also a core issue for many of the authors, that given reproductive politics in the United States at the current moment, where bodily autonomy for people who can become pregnant or people who are pregnant is under such severe threat, we think this is precisely the time to be rethinking and reimagining sperm from a variety of medical, political, social, and cultural perspectives. And ultimately, our hope is that this volume contributes to a more reproductively just society by broadening conversations around bodies, health, and equity in this country. So each of the essays was written for a general audience. Everybody took a lot of pains to kind of reduce all the jargon that they possibly could. They are really wonderful for teaching. I taught several of them in my reproductive politics class this semester. They're short essays and they provide an introduction, but they're actually written at a fairly high level. So I think even people who are specialists in these areas will learn something new. And I'm very pleased to report, maybe for the first time to many of the contributors on the call, we actually received a starred review in Booklist last week, which is a pretty big deal, and that's an indicator of both the quality and the accessibility of the book. So that's sort of used by librarians to make decisions about which books they ought to invest in. So that was really a nice sort of initial review for this book. So that's the story of Seminal's conception and gestation, continuing my reproductive metaphor. Now I will say that the book is being birthed into what feels like a completely different world than the one in which we were, conceptualizing it and editing it and bringing it together. The federal government, as you all know, is actively attacking the infrastructure for making medical knowledge in this country, and for protecting public health. And it's not clear when and how all of the creative and exciting approaches that all of you are writing about in this book are going to be able to find, a home and take root. So I think we are, having this, convening this launch in a moment of really deep uncertainty. But I think it is so important that we come together and think about all the work that went into this book and what might be the ways that we can take it forward, even given the current politics. So I really thank everybody again for being here. I'm going to turn it over now to my co-editors who will each, have the chance to say a few words. And then we're going to, we have 6 different contributors to the volume who've agreed just to say a few words about the essays that they wrote. And so that'll give you a little bit of a flavor of what's inside the book. All right, Lisa, I'm going to turn it over to you.
Yeah, thanks, Renee. And just thanks to all the contributors again, and thanks to my co-editors and Renee for just being an organizing guru here for putting this all together. This is so lovely, and it's so nice to see all your faces. So I'm going to just talk for a couple minutes, because I want to spend time hearing everyone else, but just about how this project really brought together people from various disciplines that are often not included in medical conversations and how important that is. So humanities and ethics sometimes are seen as like peripheral to medical practice and clinical practice. And what I found really valuable about this as a bioethicist and health humanist is that we had folks from literature, we had folks from philosophy, from law, we had all these folks from these different backgrounds. And I think that paints a much richer picture. And in talking about this gestation, one of the things I want to mention is when we were all in the room together, we all spoke different languages. We all had our own jargon. But we came in with this charitable approach, wanting to learn from each other and wanting to understand. And I think that's reflected in the essays, how strong they are and how they acknowledge all the key points that other disciplines bring to the table. So I think it's a wonderful model, and I hope to continue it. And then I was also going to talk about the Male Contraceptive Initiative, which, for those of you who may not know, is a nonprofit organization trying to develop and trying to support and develop male contraceptives, meaning for sperm. And so they were involved in this session too. And that's actually how Brian and I originally met, was through them. They were looking for folks, they were looking for an ethicist, and there I was. So, it's really great that that work is going forward, but that is all being funded by one individual who is really passionate about this topic. And I think that just goes to show you that there's not enough attention to sperm. And beforehand, I was mentioning that I'm working with some folks to put together a panel for the American Society of Reproductive Medicine on male fertility and infertility, and that it's not really talked about that much there and in other circles. And so I think this piece just really brings something special and unique to these conversations. And I want to thank the authors again. So I'll turn it over to Brian.
Thanks so much, and thanks so much for having me. Again, it's been an honor to work with so many scholars from so many different fields in this book. As a medical physician, it's been lovely to interact with people from all the different disciplines to enhance the way I think and to really bring together a lot of the ideas that have really been underlining my practice in the field for several years now. So to give a little background, I'm an OB-GYN who's been in practice for 8 years now. If you count my training, that's about 14 years. And if you're a male OB-GYN, you really can't help but think about your identity in your relationship to your patients. On the one hand, there's this question about how to overcome women's mistrust of male providers. But on the other hand, there's a recognition that men are sometimes the cause or contributor of my patients' concerns, either about their own health or the health of their pregnancies. So as an early trainee, I often wondered, how can I address this? I see female patients, but their problems are often at the couple level. Who's caring for both of them? Who's addressing the needs and education of the male partner? And I often came up with few resources to offer. And so to be able to meet individuals who are individually tackling this question of how are male partners or men relevant to reproductive health? How is reproductive health relevant to them? Has really helped me provide answers here. So my research has led to questions about access to emergency contraception or the morning after pill. And that led me to work with one of our contributors, David Bell, who will also be speaking today, as well as researching disparities in contraceptive development. So shout out there to Crystal Littlejohn. And then also my most latest work, which is in male contraception and development of new trials, which also allowed me to collaborate with Fabian Hennig. So again, this work has been so much more fruitful for the collaboration of others.
That's so great. Thank you so much, Lisa and Brian. And I think that was one of the spin-offs of the workshop that are not captured in the pages behind me, is the way that many of us who had been working on sperm, some of us for a very long time, from all these different perspectives, had not necessarily met each other. And so I've heard several examples of collaborative work that has come out of the conversations that were started at the workshop. And that's such a wonderful sort of additional benefit that we all had. Okay, great. Thank you both so much. Okay, so now we're going to turn to a couple of the contributors to the volume to say a few words about their essays. It was really difficult actually to choose. I wish we could have the authors of all 30 essays speak, but then we would have a launch that went on for like 7 hours. So we had to pick. And what we were trying to do was sort of spotlight the range of different topics, the different kinds of disciplines and medical specialties that are represented in the book, and also people from different generations. So we had sort of very senior folks at the workshop, and then we had some very sort of early graduate students who were just starting down this path. And so I think that all of those different sort of aspects of diversity we were really excited about in this book and are also trying to spotlight in the launch today. So for the people who are going to be speaking today, their essays cover a pretty wide range of topics. So we've got an essay on reproductive justice, adolescent sexual and reproductive health, the psychology of male infertility, eugenic echoes in trans fertility care, and legal and policy approaches to sperm donation. So I'll say thank you in advance to everybody who agreed to speak today. I've asked the contributors to each talk for about 3 minutes, and so that'll give us some time at the end for Q&A. So first up, we have Professor Crystal Littlejohn, who is Associate Professor of Sociology at the University of Oregon. And she's also the co-editor of a brand new journal being published by the American Sociological Association called Sex and Sexuality. So I'll give a special shout out to that. Zara, who's here and helping with all the Zoom logistics, actually have an essay in the inaugural issue of that journal. So we really appreciate that, Crystal, that opportunity. So for the book Seminal, Crystal authored an essay called Introducing a Stratified Reproductive Justice Approach for Sperm, Health, and Politics. So Crystal, over to you.
Hi, everybody. Thank you so much for the introduction, Renee. So in the essay, I argue that it's important to think critically about how reproductive justice as a framework is applied to groups beyond the populations that were originally specified in the framework. That's been incredibly important for how we understand reproductive rights, health, and justice today. I integrate reproductive justice, a term coined by Black women activists in the 1990s, with stratified reproduction, which is a term coined by Shelley Colden to provide a framework that will help researchers apply reproductive justice principles to other populations without compromising reproductive justice as a radical activist framework committed to the liberation of marginalized women and people who can get pregnant. And I won't give it all away so that you all can go and get the book, but I'll say that I just had a really wonderful time talking with everybody at the convening and then writing this piece, which was really important for my own thinking and development as I continue my own work. In terms of how it fits into my broader agenda, if you read this piece, which I hope you will, and read the other wonderful pieces that are part of the volume, I've been moving from creating kind of substantive theory that's more closely linked to empirical data and trying to explain social processes to working more on general theories that provide what I think about as tools for thought for researchers in the field. And so you have this piece on stratified reproductive justice. I'm currently revising a draft of a framework on what I call embodied demography, which is getting demographers to think more critically about the body and providing a framework that gives them a conceptual approach as well as a theoretical and methodological approach to think differently about the body and demography. I'm also working on a draft of what I'm calling materialist constructionism, which is what I think about as an update to social constructionism for modern times. And this is part of my broader research agenda, which looks at my current work is looking at risk tolerance and contraceptive use among couples. So with that said, I thank everybody. Thank you for inviting me to be part of this, and I'm looking forward to hearing from everybody else.
Okay, thank you so much, Crystal. And congratulations on what I think of as just a really profound essay in this volume on stratified reproductive justice. I think this is going to be incredibly helpful to both scholars working in this area and also advocates. It really does pull together these concepts in a powerful new way. So thank you for that. Next, we have Dr. David Bell, who is Professor of Pediatrics and Population and Family Health at Columbia University Irving's Medical Center. He's an adolescent medicine physician and has been medical director of the Young Men's Clinic at New York Presbyterian Hospital since 1999. And David, I am pulling these bios from the book, but I think you also have added another role since the book was published. Is that right?
Yes, but let's not go there.
Okay, let's not go there. A dean of some sort. And so David is the author of the essay in Seminal titled, "Do Young Men Care About Their Fertility?" David, over to you.
Yes. So thank you. It's a real honor to celebrate Seminal, and it was such a great opportunity to be a part of this project. It was an incredible experience with the breadth of people around the table and the conversations we had. So I'll somewhat speak for both Arik Marcel, who's a fellow adolescent medicine colleague, and myself. We explored similar ideas within different ways. But we said that young men's needs in this area have been overlooked for far too long. We focused on adolescent female health, and while that attention is essential, young men's sexual and reproductive health, including their fertility and sperm health, has not been received the care, education, and investment it deserves. So one of the central points I emphasize is that young men care about their sperm health. I've seen it firsthand as a physician working with adolescent and young adult males, whether it's worry about unprotected sex, concern about past substance use, or simple curiosity about their bodies. Young men ask about their sperm health. They want to know, is my sperm healthy? Can I have children someday? It opens the door to deeper conversations about responsibility, relationships, and their futures as potential fathers. But despite young men's interests, we have not created systems that support and engage them meaningfully. Arik describes how young men often receive less comprehensive sex education, fewer sexual health discussions with clinicians, and far fewer opportunities to explore questions about fertility and prevention. Instead of assuming young men just don't care, we should recognize the ways social stigma, outdated masculinity norms, and structural gaps in healthcare have kept them from getting the information and support they seek. So both Arik and I call for a multi-level socio-ecological approach, one that starts with the young man as an individual, but extends to families, schools, health systems, and culture. We need to train clinicians to have these conversations. We need comprehensive sex ed that speaks to young men's realities. We need public health messaging and media that affirm the ideas that there are many ways to be male and that caring about their reproductive health is a strength, not a weakness. If we want healthier families and communities, if we want young men who are empowered to be thoughtful partners and future fathers, then we must start by recognizing their concerns and meeting them where they are. Seminal helps us understand the complexities of that path more clearly, and I hope it's the beginning of a broader commitment to walk that path together. Thank you. Thank you.
Thank you so much. We really, really appreciate the contributions that you made. I appreciate that you were also, speaking about Arik Marcel's piece in the book. They were very much sort of aligned, but also offered, sort of different perspectives from, those of you who've been doing this work with young men for decades now. And so I think that was part of what Lisa was saying when we were having these conversations at the workshop and almost speaking different languages. But at the end of the day, I think the sort of approach that people are taking to think about individuals in all of the different contexts in which they exist, their communities, their families, their conversations with providers, their conversations with teachers, that was really kind of a shared framework across all the different disciplines. So thank you so much, David, for being here. Next up, we have William Peacock, who is a clinical psychologist and clinical associate professor of obstetrics and gynecology at Thomas Jefferson University. Bill, I know he was Bill, so I'm having trouble saying William. Bill has been working on the psychology of male infertility for decades and has done a lot of work in particular with American Society for Reproductive Medicine and their mental health professionals group. And for the book Seminal, he wrote an essay titled "Why Men Are Missing from Discussions of Infertility and What to Do About It." So Bill, over to you.
Thank you very much. I think David already alluded to part of the reason why men are missing from that discussion, because we really have inadequate education for young men, although it appears to be getting better because of people like David and Arik. I've been working in the field for about 40 years, and one of the things that I began to notice very early on was I'm one of the few men working on the mental health side of reproductive medicine. And I became very interested in male reproductive health. And, those classical notions, outdated notions, as David said, that men really don't care about this and they don't have feelings about this, has been disproven for many years. One of the first works came out in 1993 with an interview in Great Britain of about 40 young men who had been diagnosed as infertile, and they have a wide range of emotions, but they're reluctant to discuss those feelings. And why would they be reluctant to discuss those feelings? Well, my contribution to this wonderful book and the discussions has to do with a lot of what we don't know about male reproductive health. So we are very well informed about women who use donors, who use gestational carriers, and who use IVF to have their children. We don't know very much about men, in part because men don't come forward and talk about that. And so part of my contribution looks at, well, what can we do to improve awareness of male factor infertility? And I think there are a number of things. There could be more male mental health providers. There's a dearth of them. If you look at the organization I belong to, Mental Health Professional Group, which is the largest professional group within the American Society for Reproductive Medicine with over 700 members, less than 5% are men. And when you consider that 50% of infertility is male factor, that's a glaring discrepancy. So we could have more mental health providers. When you look at the number of reproductive urologists in the American Society for Reproductive Medicine, again, male factor infertility is 50%, about 1/5 of the providers are male reproductive urologists, and 4/5 are reproductive endocrinologists, who are all OB-GYNs. So there's a focus on female versus male there as well. We don't get graduate work in any of the mental health fields about infertility, period. We get some sexuality education, but we don't get very much about reproductive health. And so that's another area which I think could be improved. And most importantly, when a man is diagnosed and he does have an emotional reaction, where does he go with that? The number of support groups or other resources for men is severely limited. Resolve, which is the largest support organization for fertility, infertile people, has a last look over 100 support groups, and 2 of them were for men. So the discrepancy is quite remarkable. One of the encouraging things that's on the horizon and is happening more and more are virtual support groups, or used to call them chat rooms, but places where men can log on, remain anonymous if they wish and not have to disclose who they are, but are able to connect with other men who are dealing with similar situations. And so my contribution focused on that, and I was pleased and thrilled to meet all of the people who were involved, because it expanded my range of information and awareness and created a couple of nice new relationships for me as well.
That's great. Thank you so much, Bill, for being here today and for sharing that sort of broader context, that your essay is sort of the distillation of all of these decades of experience. And I'll take a little bit of inspiration from David and then mention 2 very related essays to Bill's. One by Christopher DeJong, who is here with us today, an andrologist at the University of Minnesota, and has been working for the last 7 or 8 years to found the Male Reproductive Health Initiative, which is an international organization and collective that is all about trying to increase the amount of biomedical research on male infertility and sperm health. So Christopher's essay was about male infertility, and then also the urologist Stan Honig, who is here at Yale with me, was a participant at the workshop and also spoke about his decades of work trying to increase attention to male infertility in the world of urology. And so those are sort of, the kind of, if we were going to draw a network image of the links between the essays, it would get very dense very quickly. But for those who are interested in male infertility, I just wanted to point out there's a number of really detailed and excellent essays on that topic. Okay, next up we have Steph Schuster. And Steph is an associate professor in the Lyman Briggs College and Department of Sociology at Michigan State University. They're the author of the essay in our book Seminal, Whose Sperm is Worthy? How Eugenics Promotes the Control of Transgender People's Reproduction. Steph, over to you.
All right. Thank you everyone for being here. And also I echo what other folks have said. This was a lot. I had a lot of fun. And also I think alongside that fun, there's some pretty serious political conversations that are happening even today, which I might, if I have time, come back to. So in this essay, I'm thinking through eugenics as a lens through which we can understand how trans people's reproductive health, and with the particular attention to fertility options, is made sense of by different stakeholders. And when I use the word or the term eugenics, it's really thinking through notions of worth, taking inspiration from some of Rene's work on how we can think of bodily materials in ascribing value to them, and also Michelle Murphy's work on the worthiness of life and what that means and what that looks like in practice. And so in thinking through this essay, you know, on one hand, we might think that like all of the professional associations and all the attention on helping trans folk consider fertility options is positive, like that's a social benefit. But one of the challenges, especially for trans women, if we're thinking about sperm, is that fertility preservation is almost exclusively inaccessible for them. So that raises a lot of questions, both from an economic perspective and also the infrastructure of healthcare, especially insurance, what it means when people are asked to consider their fertility preservation options, but don't actually have many pathways to doing that. The essay sits happily alongside other authors whose work also appears. So I just want to, for your attention, I think a couple of folks are on here, but Carlo and Dre Becker and also Jeremy are all, I think all of us are also thinking about, because when we talk about sperm so often, it's kind of tethered to imaginings of particular kinds of bodies. I think a lot of us are also working through what it means to trouble sex and also reproductive processes. So with that, I've been thinking in my own work more recently about bodily autonomy, and I'm not sure if folks have read the news today, but there's a recent US Supreme Court ruling where for trans youth, despite all of the efforts and all of the energy, they are prohibited now on state levels from accessing gender-affirming care. And so I think that, just to echo quickly what Rene opened with, a lot has changed since even we convened and since the book has come out. And I think that it raises really important, provocative, and also political questions about our roles as either clinicians or scholars. So, thank you.
Great. Thank you so much, Steph. And I appreciate also the sort of suggestions of other essays in the book to read. The issues that are being raised about sort of the persistence of eugenic approaches to the human body and thinking about sex and gender and race sort of percolate throughout the book. And I really appreciate that theme was so well developed also across disciplines. So sociologists and anthropologists, Karen Weingarten is a professor of literature who wrote about this as well in the world of sperm donation and sperm banking in 20th century US. And so I appreciate the description of the essays, and then also the reference to, contemporary politics doesn't even, grab a hold of like headlines coming out today, and the way that this book is going to be able to speak to some of those. And I think that's a really important and powerful way that we can contribute to contemporary discussions, is that we have thought about this in a scholarly way and can pull in some of the history and sociology and ethics of the developments that we're seeing. So thank you so much for joining us today, Steph. Next, we have Catherine Krashel, who is Assistant Professor of Law and Health Sciences at Northeastern University School of Law and the Bouvet College of Health Sciences at Northeastern University. So along with her fellow law professors, Courtney Joslin, who's at the University of California, Davis, and Douglas Najim, who's here at the Yale Law School, Catherine is the author of the essay called The High Stakes of Gamete Regulation in a Post-Dobbs World. Katie, over to you.
Great, thanks, Renee. Yes, thank you for doing the shout out to Doug and Courtney. That was the first thing on my list to do, is to thank them and reiterate that this was a collaborative project for the three of us to work on. And thank you, Renee, Lisa, and Brian, for your leadership and organization getting this book together. It was really a very pleasant and fun and enriching experience, thanks to your vision and leadership. Before I talk about our chapter, which includes concerns for the way that courts are eroding LGBTQ rights, I want to lift up some of what Steph just said and name that it's a pretty difficult and terrible day today that the U.S. Supreme Court just handed down a decision upholding a Tennessee law banning gender-affirming care provision for minors. And as Justice Sotomayor said in her dissent, quote, "The court authorizes without second thought untold harm to transgender children and the parents and families who love them," end quote. So I just want to reiterate that the threats to LGBTQ rights we discuss in our chapter that shape discourse around gender roles, reproduction, and family formation are real, coordinated, and palpable, and they feel especially so today. So I just really wanted to name that. A significant part of the work of our chapter is, in fact, situating sperm provision within this regressive U.S. legal context at the moment. It's one that's marked by increasing attacks on reproductive justice, women's rights, and LGBTQ equality, and particularly after Dobbs v. Jackson Women's Health, the 2022 U.S. Supreme Court case that struck down Roe v. Wade, which was the 50-year precedent protecting the right to abortion under the Due Process Clause of the 14th Amendment of the Constitution. Particularly after Dobbs, many of the safeguards around reproductive decision-making and parentage, which are implicated in sperm provision, those sort of legal safe rails that have been operating in the background of sperm provision are either gone or jeopardized. Notably, in his concurring opinion in Dobbs, Justice Thomas explicitly invited the court to extend its reasoning to overrule other substantive due process precedents, including those protecting the right to use contraception, have non-marital and same-sex intercourse, and marry a same-sex partner. So this list that Justice Thomas offers illustrates the way that assisted reproduction, especially the use of assisted reproduction by unmarried people and LGBTQ people, really lies squarely at the crosshairs of a lot of these contemporary attacks on reproductive justice. So for the purpose of our brief chapter in the book, or their brief essay, we argue that policymakers, legislators, those thinking about regulating sperm provision ought to proceed with caution and consider calls for regulation through a more intersectional reproductive justice lens that centers and thinks about those on the margins. We raise concerns that there are legislators that are acting swiftly without sufficient attentiveness to these issues, and that when they do that, they could stand to undermine diverse family forms, reify essentialist views of biogenetic connection, and further erode reproductive autonomy, all these things that are already under attack in our current legal landscapes. So in the essay, we note, but aren't able to fully detail, many of the proposals for greater regulation of sperm provision. These include requiring identity release of the sperm provider, creating a registry of all sperm providers and the children that results from their sperm provision, and listing this sperm provider's information on a birth certificate, which is a legal document about parentage, right? So these proposals, while they may seem politically palpable, somewhat benign on their face, what we argue is that we need to stop, pause, and really think carefully about some of the impacts that this could have and that they would disproportionately impact families that have long been marginalized and discriminated against. In some ways, the essay is a starting point for more work unpacking these issues and making more specific arguments and recommendations. So my co-author, Courtney Jocelyn, has an article forthcoming in the BU Law Review called Sperm Rules that provides a historical background to debates about sperm regulation. And in doing so, she identifies the stakes of these contemporary considerations, specifically about how they will disproportionately impact LGBTQ people. My current writing projects make the case that assisted reproduction is ripe for adopting a reproductive justice approach, particularly in light of the recent developments in abortion jurisprudence. And Doug and Courtney are actually together today at a conference, which is why I'm here and they aren't, presenting their work and their working paper concerned with the security of diverse family forms called Certifying Families, Birth Certificates, Parentage, and Biogenetic Connection. So stay tuned. We have more to say, and there certainly will be more discussion given the legal landscape that we see rolling out ahead of us. Thank you.
Great. Thank you so much, Katie, for joining us today and for the overview of the essay. I will just say it's part of a section of the book that has several essays about sperm donation and sperm banking, including by law professors Naomi Kahn and Sonia Suter, who are here with us today. An article about queer sperm and the politics of masculinity by Meredith Field, who I think is also on the call, and Michelle Bayevsky, who I saw earlier, and forgive me, the screens are too many for me to pull out, but about the genetic testing of sperm donors. So there's sort of a whole series of essays that sort of are around this similar topic. Just a reminder, we will have a brief moment for questions, I hope, at the end of the speakers. And so if you have any questions, go ahead and use the Q&A function. We'll keep an eye on that. But we're going to go to our last speaker, the last contributor to speak today, Rebecca O'Connor, who is director of the American Society for Reproductive Medicine's Center for Policy and Leadership. And she contributed an essay to Seminal called Examining the Politics, Ethics, and Legality of Anonymity in Gamete Donation. So Rebecca, over to you.
Thanks so much, Renee. And it was such a pleasure to be in this space again with these incredible thought leaders. The participation in this workshop and what followed was one of the highlights of my career today because of that intersectionality of our conversation. And you've already done the hard stuff for me of acknowledging the incredible other folks, both in the volume and in this section. So thank you for that, because I really do think that all of our works are complementary to one another in an incredible way that enriches the dialogue we're having. My contribution focused, as noted, on these these intersections between the legal questions that we're grappling with, the challenges that, as Katie so aptly noted, are facing lawmakers and policymakers as they come to an intersection of really heightened awareness, both in the public and among people that are stakeholders on various sides of the fence, and regulators who are trying to figure out what they need to know and how to respond to calls for action around regulation, around ensuring access to care. And so, I frame this as we know that 7.3 million American women have sought medical care for infertility, which is something that, of course, at ASRM we've been advocating around for decades now. And thinking about with the rise of direct-to-consumer DNA testing, what it means to promise anonymity when it comes to, donor gametes, and what is the reality now that we're many decades into that consumer product, to make a promise of anonymity. And so, we at ASRM are constantly tracking a fire hose of legislative proposals at the state and federal level around these issues. And it's complex. And as with anything in this space of reproductive health and frankly, any legislation, we too are saying, hold on, take a step back and ensure not only that you're, really thinking through the downstream impact of any decisions that are being made, both for, sort of grappling with the tension between the interests of those that are in the donor conceived community, people that have now aged to a point where they have a vested stake and interest in what has happened within their own experience, and also sort of an interest in seeing this field continue to develop protections for privacy and transparency, but also being practical about what that means for infrastructure, for providers, for banks. Do they have the capacity to meet demand for providing information? So being very intentional in both how you approach these issues and importantly, who's at the table, and making sure that you are being inclusive and including a broad swath of stakeholders in these conversations, including providers, legal experts, parents, making sure that lawmakers, when they're coming to the table to talk about things like whether to ban donor anonymity, as they did in Colorado, and other sort of, we won't go into the weeds here because I do want to allow that time for question and answers, but, make sure that you're doing it with intent and clear standards for communication, the cost responsibility, people's rights, individual. I think as someone who has walk the walk in the sense of being a patient who grappled with male factor infertility in my own experience as going through IVF. This is personal for so many people, and people are impassioned in new ways right now. So as with anything, when you are the news above the fold and people are really putting a spotlight on an issue, there's a knee-jerk response that happens in state houses across the country. And that's kind of the thrust of my argument that, slow down, really think through what we're looking at here. If we need to talk about the Equal Protection Clause, if we need to talk about HIPAA, and sort of interweave those conversations into our desire to meet the needs of this community, which we should be respecting.
Okay, thank you so much, Rebecca. And I am going to actually there's a couple questions that we've received. I'm going to hold off on Q&A. I'm actually going to turn to Jennifer Reich next. Jennifer was actually a contributor to the book as well, with a really important essay on how to talk about men's reproductive health without centering men. But she is also the editor of the series Health Society. Let me get this right. I'm also on this board and I should have it memorized by now. Where is it? Health, Society, and Inequalities. I remember debating with you what order those words should go in. So Jennifer is the editor of the series at New York University Press, in which the book is being published. She was also at the workshop, wrote an essay. I also wanted, before I turn it over to Jen, I also wanted to say a huge thank you to Eileen Kalish, who is the executive editor at NYU Press and was the editor behind the editor who made this book come to life. Eileen, thank you for being here. It's good to see you. And I see a couple of your staff as well. Aini Jong, who helped us with the page proofs. And so it's wonderful to have so many people from the press here as well. So Jen, I wanted to give you an opportunity to say a few words about your essay, the series, and how the book fits into your vision for what the series is trying to do.
Thanks so much. And obviously we could talk for a long time, but I'll just start by saying that I've worked with NYU Press for a long time. And so, and I had written a book about vaccine politics, which I'll just say nobody thought was particularly interesting when I wrote it in 2016. And one pandemic later, there was lots to say about vaccines. And because of that relationship, Eileen and I were talking during COVID about what NYU had in their portfolio around public health. And we started talking about developing a series, which ended being the Health, Society, and Equality series. And the goal with that series that I'm overjoyed to edit is that public health is not one thing, but also we wanted a series that was beyond public health and beyond medicine that really got to the questions of where the social, the cultural, and the regulatory and institutional shapes of individual experience come together. And so the books that we've been able to develop in that series, we have 6 books in press. And if you haven't seen a physical copy of Seminal, which I hope you all win the prize today, so you can hold it in your hands, is gorgeous. But we have books on immigrant access to healthcare, the politics of health, of care work. We have several books on reproduction, on access to medical care for gender diverse people, and also this book on sperm. And we have new books coming out that question sort of the regulatory and structures of medicalization of obesity, of who has access to reproduction, of sexuality, of criminalization of bodies and reproduction. And we have these sort of exciting opportunities to really stretch the meanings of health and public health as we think about them as scholars. And as a sociologist, I feel really grateful that I have a hand in able to give authors a lot of support that's also context specific. Although we have contributors who are also not sociologists, but who are weighing in on these kinds of topics. So you can take a look at the series if you're interested. It's at nyupress.org. If you go to the link at the top that says series, you'll see under health our series link. And if you're interested in submitting a project to us, that would be great. And I'm excited about this in part because Rene and I have had this ongoing dialogue around our work for more than a decade. And as we started talking about what was next, the ideas for Seminal of like, how do you bring people together? What would it look like to really have true cross-disciplinary conversations? And then how could we put them together in a framework that's accessible to a wide range of readers, from undergraduates all the way through content experts, and also a chance, I think, to what Lisa pointed to, bridge our vocabulary differences, to think about it. Brian and I connected over men and abortion also like 15 years ago, right? Like, how do we start to think about pulling all these conversations together and bringing us in dialogue? And so I feel really honored to have been a part of the conversation in real time. And I think you could imagine we would all be having amazing conversations if we were in person today. And then also, what does it mean then to sort of see that through into an accessible, complete collection that you all can hold in your hands and share with your students, or use to sort of continue to stretch your own thinking on these topics. And so I can stop there so we can have time for questions and for the fantastic drawing that I hope you all win.
Thank you so much, Jen. Really appreciate that. All right, so I'm going to have Zara post in the chat at this point the link to enter the raffle for a free copy of the book that we will mail directly to you. And then there's also a discount code, and you can read more about the table of contents and all the authors. We have a couple of questions in the chat. And so I wanted to first answer the one from Richard Gibson, which says, to what extent do these analyses engage with contexts outside the US? And it's a short answer because we kept this book focused on the US, because to talk about sperm health and politics, even just within this one country, was complex in and of itself. So we made a pretty intentional decision very early on to keep the book focused on the United States. And we do try to sort of indicate that, in the back cover and in the introduction and all of that. So it's a great question. Caitlin Killian, if you're able to unmute, I was going to say welcome. It's nice to see you. You are also the author of a book on reproduction, so you should plug your book. And then you had a question about how smoking, toxins, and other exposures affect sperm that I was going to invite Christopher DeJong, if he's able to unmute and be a part of that. He is going to be the expert to answer that particular question. So Caitlin, if you want to go ahead, and Chris, if you're able to answer, that's great.
Hi, Renee, and thanks for contributing, to my textbook edited volume that just came out as well. So congratulations to all the authors. My question was really, I've always really wondered about fevers and men preconception having fevers like, in the 2 months before conceiving, thinking about all the things that we do know affect sperm, all sorts of toxins and things. And I'm just wondering if anybody has looked into that aspect, and especially wondering things that may cause miscarriages or birth anomalies that then women feel responsible for, not that anyone's responsible for, but so that was my question.
Do you want me to answer that? Okay.
That would be great. Thank you.
So fever, that's a great question because sperm production is temperature dependent. So if you increase temperature through fever, it's going to have an impact, depending on the severity, on sperm production. Furthermore, is that there's evidence that not only does the temperature cause sperm quality to go down, it appears also to have an influence on the DNA, to cause little breaks in the DNA. And so this is a problem, clearly, but it all clears up in about 72 days later. So when new sperm are made, millions of sperm are made every day. It's just the strangest thing, really. In regards to other potential toxicants, there was a story in the news today about cannabis and the effects that cannabis are seemingly having on not only sperm production, but the quality of the sperm being produced. And many times the sort of characteristics around this are people who, using cannabis as the example, are frequent smokers. Just as if you were a frequent smoker of cigarettes, it's not good for your body, eh? So live a healthy lifestyle, and then you have a better opportunity to do an investigation should there be complications in conception or things like that from the male perspective. Hope that helps.
Great. Thank you so much. Okay, Lisa and Brian, any last words before we wrap up?
I mean, just to address the question as well, I mean, I'll add that as an OBGYN, I'm moving away from the use of the word miscarriage, calling it early pregnancy loss instead, just to destigmatize this idea that it is an issue with the way the woman carries the pregnancy. But in fact, there's a male component to it as well that clearly is worth further research.
Okay, all right. Well, I think we could go on for some time, and I would be happy to. This has been just such a wonderful, collaborative conversation to be in with all of you over the past couple of years. I am so excited that it has now been captured in this beautiful, beautiful book. Jen is right; it is just gorgeous, and just so kind of dense with knowledge and insights. And so it's been a pleasure, and thank you all so much for your contributions. Thank you so much for being here today, and we look forward to keeping the conversations going. So thank you so much. Right. Good to see everybody.